many man.
Shot. Frontline medical workers and essential staff will be prioritised for the Pfizer-BioNTech inoculation. The vaccination drive will then be expanded to include the elderly and other high-risk groups. Malaysia has more than 66 million doses of COVID-19 vaccines. That's enough to cover its population. The aim is to vaccinate at least 80% of the population within a year.
COVID-19 or coronavirus disease 2019 is a contagious disease that caused by coronavirus SARS-CoV-2. In January 2020, the disease was spread around the world. As a result, all Prime Minister had ordered all citizens to comply with the Movement Control Order (MCO). The symptoms COVID-19 were fever, fatigue, cough, breathing difficulties, loss of smell, and loss of taste. Moving on to the SWOT.
Dan untuk itu kerajaan memutuskan untuk melaksanakan perintah kawalan pergerakan.
So for SWOT, for the first is strength, more have strong leadership and integration of technology and also an effective healthcare system. Second, the weakness, more has a shortage of healthcare worker, lack of financial resource, and burnout among the frontliner. For the next SWOT is O, that is opportunities, the improvement in healthcare infrastructure. Next is increased public awareness, and lastly, mass vaccination program. And for the last is rumors and misleading information around the community. Next is economic pressure, and lastly, risk of imported cases from international travel. So that's all from me. Bye.
So we move to managing the issue, planning. First point, we have planned Movement Control Order (MCO). All school, office and shop have been ordered to close. Second point, we have do a swab test to know our health status. The next point, create quarantine and treatment center called MAEPS, Serdang. Lastly, we have to improve the hospital facility. Move to the next one, managing the issue, organizing. First point, organize the national policy, for example, tighten the movement control order. Second point, organize the national COVID-19 immunization program. And lastly, coordinated with National Security Council such as police and army.
We will move to controlling. First and foremost, controlling is monitoring daily COVID-19 cases, death rates, and patient. Next, we will enforce Standard Operating Procedure (SOP). Next, we will use Messages app to track cases and contact tracing. Last but not least, we will conduct a penalty for SOP violations, such as not wearing a face mask and not maintaining 1.5 meters.
Then we will move to the next topic, managing the issue, leadership, and decision making. First, we will choose vaccination types and paces, and then we will update guidelines based on WHO. Next, MOH issue press conference every day through TV3 and other bulletins. Lastly, we will do improvement in the government hospital.
Now, moving on. Some suggestions or recommendations that can be done is to strengthen collaboration with local government or NGOs. Next, innovation in education and learning. Other than that is to improve healthcare capacity in all hospitals and clinics. And lastly is to provide mental health problem service or counseling. To conclude, the topic that have been discussed today is the Ministry of Health has played an important role in overcoming the contagion of COVID-19 by planning, controlling, leadership or decision making and organizing. They have worked tirelessly to ensure that the rate of transmission of COVID-19 disease decreases and that the people can live in peace without being enveloped by the fear of COVID-19 disease. Everyone can be aware of the importance of maintaining cleanliness, safety, and health.
Kementerian Kesihatan melaporkan satu kematian COVID-19 pada Minggu Epidemiologi ke-35 sehingga 6 September lalu. Kematian melibatkan seorang warga emas terlantar berusia 91 tahun. Secara kumulatif, 3 kematian COVID-19 telah direkodkan tahun ini. KKM juga mengesan penularan varian baru XFG dengan 8.2% daripada 43,087 kes melibatkan varian itu. Jumlah kes mingguan 594 menurun 12.8% berbanding minggu sebelumnya. Justru KKM menasihatkan orang ramai untuk terus mengamalkan langkah pencegahan asas. Ini termasuk kerap mencuci tangan, memakai pelitup muka jika bergejala atau berada di tempat sesak serta mendapatkan vaksinasi bagi mereka yang berisiko.
As you plan activities for the upcoming July 4th holiday, health experts say to be aware of a new COVID variant that's spreading, and it could lead to a summer wave of the virus. Reporter Mandy Gaither has what to know about the new variant and the defining symptom to look for.
It's related to the Omicron variant. NB181, nicknamed Nimbus, is spreading in the U.S., now causing more than 40% of COVID-19 cases, according to the latest CDC data.
It is a little bit more infectious and contagious than kind of the last couple of versions that we have seen before. So we're seeing a pretty rapid rise in the number of cases related to Nimbus.
Dr. Carrie Horn with National Jewish Health says as people gather to celebrate the July 4th holiday, there's an increased chance for the virus to spread even more.